Welcome to the HPV Education Project. Today we're going to be talking about new and important advances in HPV testing for men and women. Hi, my name is Robin LaCrosse, and I'm a holistic health practitioner who specializes in women's reproductive health. I'm the founder of the HPV Education Project, and I have 25 years of experience as a holistic sex educator, and unfortunately, I have personal experience with HPV. Today we're going to be talking about the basics of HPV, and then we're going to talk about testing. I'm going to try to keep this short and to the point. First, let's talk about HPV. The virus comes in many different flavors. There are about 200 different strains of HPV that affect the human body. Not all of them affect the reproductive tract, only about around 40. And even though HPV is a wart virus, not all of the strains cause warts, and some of the warts can be too small to see with the naked eye. And most people who carry HPV don't know they have the virus, men in particular, because there are no HPV STD tests for men. Women get tested if their pap smear is abnormal. They say that approximately 75% of the sexually active population has been infected with the human papillomavirus at one time or another. So how do you get HPV? It's a great question. It's through intimate contact. So skin on skin. So condoms don't provide 100% protection. They do provide some. So what happens after you've been exposed? Well, it really depends on three important factors. One, your immune system, your overall state of health, and which strains you were exposed to, because some are more aggressive than others. One of five things may happen. Your body might fight it off, and you'll never know that you had it. You could get genital warts depending on the strain that you were exposed to. The virus could affect your cervix, and your pap smear might come back abnormal in about 4 months or so after exposure. The virus could also be present, but the immune system might keep it in check, so it might not cause any problems. And then the virus can also lay dormant in the tissues for many years and only become active during times of stress in your life. So, with an HPV infection, there really are no symptoms. It depends on the strain you acquire, of course, but unless it's causing warts, you're probably not going to know that you have it. It can hide in the tissues for years, like herpes. And as I mentioned before, not all strains produce warts. And the strains that adversely affect the cervix, they don't produce warts at all. So usually women find out that they have the virus when the pap smear comes back as abnormal. So how do you protect yourself when they're not testing for the most common sexually transmitted virus that's out there that can put you at risk for HPV related cancers? Great question. The standard testing for STDs, you'll notice that HPV is not on this list. So there are a couple different ways to get tested for STDs. Blood tests will be how you find out if you're positive or negative for HIV. Herpes can detect if you have had antibodies in your bloodstream to herpes 1 or 2, which can signal that you have had herpes infection in the past. So it could be lurking somewhere in your nerves, waiting for times of stress to come back out. The hepatitis test, that can be transmitted through bodily fluids, so that might be something that's good to test. Chlamydia and gonorrhea, syphilis, trichomonas, these are all going to be urine or sample swab tests. When somebody does a STD panel on you, ask them what test that includes, because it might not include all of these, so it's good to ask. And I wanted just to double check to make sure that there were no tests for HPV, just to make sure. And, so I went to Planned Parenthood's website because I figured they're probably one of the biggest one of the biggest organizations that does STD testing, right? So here they say there are no HPV tests for men. And for women, it's testing the pap smear. And they're only doing that if your pap smear is abnormal. It sends up the flag. They test it automatically. If your pap smear is normal, they don't check it because it's unnecessary, basically. So they think, anyway. So if you want it done, you can ask specifically to have it done, even if your pap smear is normal, and they may have to like make a note of that because they might not test anyway at the lab. So every year there are a ton of STDs that are diagnosed, almost 20 million new cases, and over 14 million of those are HPV. So they did a study, a large sample of the population. It's really the only place that men can get tested is in these studies. It's not being offered to the general population. So in this study that sampled a large segment of the U.S. population, they found that 45% of men were positive for HPV and 40% of women. And then of that 45% of men, 25% of them were positive for high risk HPV. So that's 1 in 4. And then it was 1 in 5 for women who were positive for high risk. Now, if you look at this chart here, what's really disturbing is the African American community is really having serious problems with HPV. Upwards of 65% of men and women are testing positive for HPV. And I know from other things that I've read that a lot of African American women are being diagnosed with cervical cancer. So this is like a huge problem. This study also took a look at oral HPV. And again, men were about 7% of men were infected, and then just over 1% of women. And then again, in the African American community, like 15% of men are testing positive for HPV. And, the real danger of this is oral HPV, and a certain segment of these guys are testing positive for high risk. And that's putting them at risk for oral and throat cancers, which we know that men are being diagnosed at the same rate as women are being diagnosed for cervical cancer. So I'm really excited that for the first time ever, couples can test for HPV at home. And what's nice about that is it won't be on your medical record. It's anonymous. So there won't be any kind of pre-existing condition in case it causes a problem for you in the future. And it's the first time that we've even had the opportunity to test before you jump into bed with somebody. Because what happens is you get tested, you get a clean bill of health, and then all of a sudden, a few months later, you go for your pap smear and it comes back abnormal, and you're being told that you have an STD that's putting you at risk for cervical cancer. And how does this happen? It happens because they're not testing for it. And so this changes everything. This is an amazing tool. We can test oral, we can test anal, we can test vaginal, we can test penis. Men and women can both get it done. So you can go to your doctor for the rest of the STD testing. It could be covered under insurance. It just depends on your policy, if you have insurance, this kind of thing. But for the HPV testing, that is not available through, I'm going to say 99% of healthcare providers. This technology is becoming more available. We're trying to spread the word. We're looking forward to it becoming mainstream. Finally we have a really great tool to fight back against HPV and really be proactive about protecting ourselves. So here is an example of the at-home test kit. Okay, so there's a couple different test kits. This particular one here on your screen is a complete panel of anything that you can do swabs for, okay? You can do this orally, you can do it vaginally, you can test the vulva, you can test anal, and you can also do a penile collection. So men and women both can do this. And it tests for HPV 16 and 18, which are the two that are most likely to cause cancer. And then it tests for a pool of 12 high-risk virus. So if you don't have 16 or 18, but have other of these 12 high-risk HPV viruses, it'll get flagged for high risk, but you won't know exactly which one you have. And for most purposes, that's fine. You don't necessarily need to know that, although some people would like to know. Then chlamydia is a good thing to test for. It can be a silent infection, and it is responsible for about 15% of cases of infertility. So it can definitely cause a lot of problems. Herpes. So we can test for herpes 1 and 2. And then if you'd like, you can do the optional add-on to test for genital warts. So that's an extra $20. And that'll test for HPV 6 and 11. Now you can order these tests through the selfcollect.com website. And if you use my coupon code Fertility Diva, and Diva is spelled DEVA, it'll give you 10% off any of the STD panels that they have on their website. And I noticed that it wasn't covering some of the individual tests, so I'm going to see if I can't get those covered for you as well. So let's talk about the genotype testing. So there are two different types of testing. On the Self-Collect website, you have access to the HPV high-risk virus test, and that's the one I just mentioned, which is the HPV 16 and 18. So they'll tell you which one of those you have, or the pool of 12, which, you know, you can be positive for those, but you won't know exactly which one it is. It's very cost effective. It's only $89. And if I can get the coupon to work for that, it'll be 10% less. So that one may be cheaper by the time you actually put the coupon code in. Advantages of knowing for both of these tests really is to prevent transmission from your partner and also enable yourself, if you're positive, to take proactive steps to protect yourself from HPV, you know, causing problems with your cervix, or if it's oral, you know, in your mouth or your throat, so you can be proactive in that way. The HPV full genotype testing option there's an interesting story behind this one. I know from speaking with the representative at West Coast Laboratories that they have the capability of doing the full genotype testing, 49 different strains of HPV. But they're not making that available in the high-risk HPV test for $89 because it costs more, and a lot of people don't necessarily need that information. If you're going to, you know, go to your doctor to treat it, they don't need that information. They're just going to do their standard treatment. They're going to give you a leap or cone biopsy, or, you know, whatever is appropriate for your situation. And so having that information doesn't change what they're going to do. But for somebody who has intention of addressing this problem naturally, having that additional information can be really useful. So for those of us who want to know exactly which strains of HPV that we have, we can do the HPV genotype testing. And this is going to be full genotype testing. It's going to go through 49 different strains of the HPV, and you can find out exactly which ones you have. And the price, in my opinion, is still very reasonable. It's only $150, and I think it's a great option. You can get either one of these as oral, vaginal, anal, or penile. So you just have to differentiate on the order form and we can set you up. So what'll happen, actually I'll get to the order form in just a second, but interesting with the HPV genotype testing, as I was saying, I know that the lab has the capacity to do this, but they're choosing not to. And so I had conversation with the rep at the lab, and I asked her, I said, if I have clients, if I have people who are interested in knowing which strain of HPV they have, is this something that we could make available? Could they get that through me? And so she went to talk to the people at the lab, and she came back and said yes, and this is how much it would cost. And I said, okay, awesome. She said, if you want, I'll make you an order for them. I said, perfect. That sounds wonderful. So right now, I'm the only person who is offering this genotype testing. West Coast Laboratories, they have the capacity to do it. They're not marketing it right now. So if that's something that you're interested in doing, then you would want to download a copy of this form here. And actually, now that I'm looking at it, I'm realizing I just revamped it today, so it looks a little bit different. But basically what you'll do is you'll download the form, you'll save it to your computer, you'll open up the form, you can fill it out on your computer, save it again, and then you'll attach it to an email, and you can send it to orders@selfcollect.com, and they will send out a kit. And then what will happen is when you receive the kit, it'll have a number. You'll go to their website, you'll enter in that number, and so the test itself will be anonymous. You'll collect your samples. They will send, you will send your samples into the lab. They'll process it. They'll upload your results onto the website, and then you can log in and see what your results are. And so, they need your information to send you the kit, but they don't attach that information to the little sticker that's in the kit that you put into the website online. So it's completely confidential. If you choose to do the full genotype testing, what happens is, because their website is not set up to deliver the full genotype information, they will post the HPV 16, 18, or high risk, because they can do that. And then they'll send you a paper copy in the mail of your complete results. So that way you can see exactly which strains of HPV you may have. So depending on, if you just want to find out, if you have HPV, you already know you do, then you might want to just go for the complete full genotype testing. If you're not sure, you might just want to run the high risk panel because it's a little bit cheaper, and then if there's a problem, then go back and do it later. You'll see here with this order form here is you get access to the full high risk genotype testing, the full genotype testing. That's $150, like I mentioned. And then the STD panel, this is the panel that I mentioned before, and it includes just the high risk one for $89. But if you'd like, you can get the full genotype testing. So you can do like the full panel. So you're getting HPV, chlamydia, gonorrhea, and herpes. And you can choose which site you want. It's $135 per site. And then if you want the full genotyping add-on, it would be an extra $50 on top of the $135. So a couple different options on how you want to do it. So if you're like, say for example, with a new partner, for $185, you could get the full STD panel. This doesn't include the blood test. It doesn't include HIV, which is important. So you may want to go to your doctor for that. And, as things are, you can get it done as part of your well woman exam if you haven't been in So once you set up your account online, I believe they have a place where you put in your payment information, and then once they receive your kit, then they charge you. I think that's how it works. So not totally sure because that's their end, which I'm not um, involved with, and I didn't ask that question. But if you have questions, you can definitely contact me. I'm here for you. I am totally happy to answer your questions. You can just email me. Visit my website, hpvedu.com/testing to access the different tests to get more information. Thanks for listening. Have a beautiful day. Thanks.